First of all, thank you all for having me. You are a very warm and welcoming group, and it's a true honor to be able to speak with you today. I was diagnosed with lung cancer in September in 2001, and it was an incidental find. I had gone in for a hysterectomy. They did a chest x-ray. They told me I had a few infiltrates in the left lower lobe, and they treated it initially as pneumonia, and we followed it up 2 weeks post-op with another chest x-ray, which was completely unchanged. So from there, they ordered a CT scan. Well, the CT scan revealed an 8-centimeter mass in the left lower lobe and a couple of nodules in my right lung. And so then I went to go see the pulmonologist who did the bronch. And at this time, I was 42 years old. I was young and healthy. I was completely asymptomatic. I didn't have a cough. I wasn't short of breath. That summer, we had taken a 3-week vacation to the Rocky Mountains, and I had hiked to elevations of 14,000 feet and felt fine. And so the pulmonologist is saying, I don't know what this is, but I'm sure it's going to be okay. And, well, he called me the next day and said, why don't you come on in and talk with me? He said, I've got some bad news. He said, there were a few cancer cells on the slide. So, I'm trying to think, okay, well, a few, translate that to maybe 3, cancer cells. We've caught it early. I'm asymptomatic. This is going to be okay. I'm a nurse, and my whole life I've worked in cardiac cath lab. So I knew the cardiothoracic cell number, and I knew where he was that day. He was out on the golf field. So I leave the pulmonologist's office, and I call him up on his cell phone, and I said, listen, I'm going to admit myself to the hospital under your name. I'm a nurse. I'm going to write my own pre-op orders. You can continue your game. Just come back at 7 o'clock, and I need you to take out my left lower lobe. And you can imagine how well that went over. He's like, no, you're going to come and see me in the morning. We're in my office, and we're going to talk. And that's when he started talking to me about metastasis. And he said, most generally when it's this large, it's metastasized somewhere else. And those are things I hadn't even thought about at that point. So the next few days were filled with a lot of scans. We did bone scans, brain MRIs, every kind of scan imaginable. And the last thing he was going to do was a PET scan. And the morning after the PET, I was to have my left lower lobe taken out. So he comes in that morning. I go to the hospital. He comes in the next morning, and he said, I can't do your case for you this morning. And I'm thinking I'm getting bumped for a heart case. And I said, you can't do that. I'm ready for this. Please don't bump me. And he said, no, I can't help you. And I just didn't get that at first. And I'm arguing with him. I'm still thinking he's going to do the surgery, just not quite then. And he kept saying over and over, I'm not going to be able to help you. And then I realized that he was saying, I can't help your situation. So I said, where else did you see the cancer? And he said that the PET showed that the cancer was in the cervical spine to the base of my neck, or up to the base of my skull. It involved both clavicles, the lymph nodes around my neck, mediastinal lymph nodes, total thoracic spine involvement in the liver and both adrenal glands. But he said the nodules in the right lung were okay. So he got me in that very same day with an oncologist in my local community. I live in Bowling Green, Kentucky. And that oncologist, what I remember the most about her was every time she spoke, she shook her head no, This is going to be a bad situation. We're not going to have a good outcome. She did order a few more scans, and I was to go back and see her in a few more days. And when I went back, what she told me at that point was she wasn't even going to recommend treatment. She said she could give me chemotherapy, but it would only make me sicker quicker, and the end result was going to be the same. So her final advice was go home, spend time with your family, and enjoy what time you have left. Well, I still feel very healthy. I mean, I hadn't any symptoms. And it was so overwhelming to be told You're dying. There's nothing we can do about it. And you just need to go home and live out your life. So I never did go back to see her. I thought, okay, we've got to move on. But I didn't know what to do. I got online and started looking up my particular kind of lung cancer. And whoever was writing articles about it, I assumed they were the authority. So I'd write them and ask them, what would you do? Where do you think I ought to be seen? And probably 80% of them wrote back, and they told me to get to a cancer center and go on to Vanderbilt. It was in my backyard. So that's what I did. I went to go see another oncologist at Vanderbilt, a thoracic oncologist. And he said, you know, you're going to be one of those kind of patients, aren't you? You're going to be one of those who make me show you by biopsies where all this cancer is. But one thing that he did do was he went ahead and went to the thoracic tumor conference was that day. He said, I'll present your case at the conference. And it was at that conference that I met Dr. Matthew Ninan, who is a thoracic surgeon. And so he came back in after conference and he said, you know what, I don't believe the PET. It doesn't fit your clinical situation. And he said, but I am concerned about the nodules in the right lung. And what had happened in Bowling Green was they looked at the PET, the radiologist looked at the PET, and they made the readings for the CT scans to kind of match. All the lymph node enlargements that was uptake on the PET, they were saying were enlarged on the CTs. And Dr. Ninan said, when you throw the PET out and you just look at everything else, it doesn't look that bad. But he was concerned about the mediastinal lymph nodes. He was concerned about the nodules in the right lung. So the plan was to go in and do a wedge resection on the right upper lobe, take those nodules. If they're negative, go on and do a MEAD. If that's negative, he said, I think I can help you. We'll take out the left lower lobe. And I readily agreed. I thought, finally, somebody is seeing this for what it is. And he was actually the first doctor who allowed me to have hope. I felt like, okay, there's someone that's going to finally help me. But I woke up from the first surgery, and I feel up here, and there isn't an incision. And I knew immediately it was also in the right lung. So he comes in after I've waken up from surgery, and he says, I'm sorry, but there's really nothing I'm going to be able to do either. He said, it was in your right lobe. You need to go back and find talk to the medical oncologist, and we'll see what kind of clinical trials we can get you in. And that was probably my lowest day because I felt like I had exhausted everything. And here I am, I'm back to just medical treatment, and I knew already medical treatment was not effective in most cases. It just wasn't. I had this huge tumor. But what happened after that, at 9 o'clock at night, I'm sitting up, I've got chest tubes from the surgery, sitting up in the chair, and the phone rings, and it's him. And he said, I've been thinking about your case. He said, you don't fit our typical lung cancer patient. You don't have other risk factors. If you still want me to do your surgery on your left lung, I'll do it. And his thought was, I don't know if I can change your prognosis, but I don't know that it won't either. At least we can get rid of this huge tumor, and then we'll go from there. So I spent 5 days in the hospital on that. When I got out of the hospital, I was to meet back with the medical oncologist, and the following Friday had the surgery for the left lobectomy. And when I went back in to talk with the medical oncologist, and this is still at the same institution, he said, well, are you ready to sign up for your chemo? And I said, no, I'm going to go ahead and have the surgery. We'll do chemo after the surgery. And he said, no, he's not going to do it now. And I was totally confused because 4 hours later I talked to him and I said, you know, that we already had the surgery planned. And he said, no, he had just spoken to him 30 minutes before and the surgery was off. So he offered me a clinical trial with matrix metalloproteinase inhibitors. And for some reason, I just said, can I speak with the surgeon again? I really wasn't going to try and talk him into doing surgery at this point, but I wanted